Good morning, everyone. My name is Miriam Blaise. I am the founder of Athlete Soul. I welcome you to one of our educational webinars today with Kelsey Ruffing. We're going to be talking about mentally adapting to exercise, nutrition, and body post-sport. So what happened after you retire from sport? I have a couple of things to just talk about before Kelsey gets started. First of all, we are recording this event, so just wanted to clarify this. It will be available on our website to view after the event, and we will be sharing it with our registered participant as well. Second of all, if you have any questions, you're welcome to ask your questions in writing. You can do so either in the Q&A box or in the chat box. I will be taking note of the questions during the call, and I will be asking them at the end of Kelsey's presentation. So we'll go with about 20 to 30 to 40 minutes, depending on how much Kelsey has to say on the topic, presentation from her, and then we will do question and answers after that. So stay with us at the end so that you can listen to the responses from Kelsey, and that's basically it. We're going to be starting. Kelsey, I will leave everybody with you, and I will let you introduce yourself. Thank you for joining us and taking the time to do this presentation for us. Much appreciated.
Thanks, Miriam. Thanks for having me, as always. I will keep it under 3 hours. I feel like I could talk about these things forever, so it's definitely going to be less than 3 hours. But as Miriam said, I'm Kelsey Ruffing. I am a licensed clinical professional counselor. I'm finishing my doctoral degree in clinical psychology, and I have an emphasis in sports psychology and health psychology, and I have a practice in the greater Chicagoland area. It's me and about 3 other clinicians who are wonderful, but we see kind of the general gamut of things: anxiety, depression, but I specialize in chronic pain, chronic illness, and sport injury, and we also specialize in health psychology and sports psychology as a whole. So a little bit about my background is my master's in clinical psychology and clinical psychopharmacology, finishing that doctoral degree, and my dissertation is female ACL tears and identity, which is a work in progress right now, a long work in progress. Getting right into it, there is just so many times working with athletes that are either current athletes or retired athletes, and they don't have to be newly retired. Sometimes it's 10 years after, 20, 30 years after sport retirement that we are just starting to work on these things and get in touch with them, because there's been so much maybe cognitive dissonance in that time where athletes who are retired don't realize that there's this shift. There's the shift from your mentality of being an athlete and everything that goes with that to now being a retired athlete and everything that goes with that. And it's interesting because it's kind of this unconscious thing that happens, but now we're just seeing so many prolonged issues due to it, that these topics have just become so important, and have probably always been important, but there's just more emphasis now. So in my own practice, this comes up quite a lot of athletes who are currently playing, who know their time is coming to an end, and are trying to actually be proactive and prepare. And they tell me about some of their fears, which are things like, I'm afraid to gain weight. Especially my females, they're like, I'm afraid that after I stop playing, I'm going to gain 20 pounds, and that's not going to look good. I also have a couple clients who have been retired from sport who struggle with this identity piece and have difficulty finding passions or finding their kind of true calling, and have just been stuck in jobs that aren't really giving them much purpose. And they struggle. They tell me about their struggles with how they talk to themselves about nutrition, how they talk to themselves about their body and their transitions with their body. And, going from an athlete to then sitting all day, and maybe some aches and pains that go with that, and just feeling really disconnected from self. So there is this shift in mindset. There is a difficulty with the transition from this competitive exercise routine, right, of being an athlete, and then to this more exercising for wellness and well-being. When we talk about nutrition, to fuel your body after recovery from your competition is most of the time the main focus of your nutrition as an athlete. Like, how can I give myself fuel to perform my best? How can I recover? And a lot of times, though, it's also, I don't care what I eat, because I know that I'm working out so much that I just burn right through it. So if that's the case, there's two sides of that coin, but if that's the case, moving towards whole health, wellness, and nutrition, and your relationship with food looks different maybe for somebody who's like, I'm going to eat whatever I want because I'm an athlete, to then I'm eating whatever I want and I'm not a competitive athlete anymore. And that causes some issues. Or an athlete who is very strict in their food regimen while competing, and then retires and then is still very strict and doesn't know that that might actually be disordered eating, and that it doesn't actually have to be so strict. When we talk about body image, athletes use their body as a tool, right? That's their job, their tool for their job and performance. And athletes, hold a lot of honor in their body and are willing to sacrifice their body. And the body is really kind of everything for them. And athletes have this, type of a body type, what they should look like or should be like. And, a lot of times we look at athletes as very strong and they are the epitome of health. And, all eyes are on them, and their body helps predict their performance. And so when they're no longer competing, we kind of come into trouble here with, you're getting older, right? Things happen in life, injuries happen, pregnancy, just aging. What does my body feel like? What does it look like now? There is a change in your body inevitably as we age, and that's really difficult for a lot of athletes to deal with and cope with and manage. And then I added a piece of identity at the end. Identity could be a whole talk in itself. So I just wanted to hit on that because there is this shift in identity, and it is a very big shift. But I'm not going to get too much into that now. So when we talk about exercise, I don't think we actually take the time to think about, what does exercise actually truly mean? What is it for? Why am I doing this? As an athlete, you know that you're exercising and you're training for your sport, for your competition, for performance. And that's always the goal. And that's how you go about exercise for years and years and years, right? So people who have been in sport for 12, 15 years, this is how we think about exercise. So shifting that mindset after sport is very difficult. You go from this kind of cohesive, supportive atmosphere of either working out as a team or having trainers and having people who are really supporting your exercise regimen and telling you where to be and telling you how to work out, and maybe how much weight you need to lift, to then solo workouts. You're trying to maneuver things on your own. Maybe you're not as motivated on your own. You go to the gym and you're like, I know what to do, but what do I do? So there's not much guidance there. And, when we talk about the intensity of training, most of the time athletes will have difficult, intense training regimens, and they need to stick to them, and they're pretty strict, and, everybody's behind that, the coaches, the trainers, and then you make this shift and it's kind of like, well, now what? When I'm a retired athlete, now what do I do? Because the intensity part is hard to get on your own and outside of sport, and is it necessary? So a lot of the research, looking at this, and I'm using females here in particular, but a lot of the research shows that female athletes, they had this preference towards these high intensity workouts, which were mostly caused because of the body image and how they wanted to look and how they wanted to feel. And they had a lot of difficulty in adapting to this lifestyle where physical activity was no longer the main focus. So they had this preference for really high intensity workouts, and then maybe for reasons that they needed to shift in, right? Maybe it shouldn't be about the body image concern, but more so health and well-being. And then this difficulty in adapting to this new lifestyle where, you're living life, other things are more pressing. Maybe there's children or work or, other things that are just kind of not get in the way, but take over because we aren't training every single day as athletes, and that's not the forefront anymore. And this research from 2017 also indicated that although female athletes were exercising as, guidelines say, at least 30 minutes a day, they still perceived this to be insufficient. So going from having these workouts that were maybe like 5-6 days and being high intensity to maybe only being able to work out 3 days or 2 days and maybe an hour long instead of the 4 hours, that they felt that this was really insufficient, and it was really frustrating for them. And that doesn't mean that they have to work out more or be more intense about it, but it's the perception part that is the shift. So, can actually 30 minutes of your day designated towards exercise, can that actually be sufficient in your life? And a lot of times it probably can be, but we're just stuck in that cognitive space of still being a competitive athlete. So this exercise mindset, what do we have to do to shift towards maybe retirement phase of exercise? So the goals and the intention of exercise change. We should maybe be looking at this shift towards more fun or interest piquing exercises and trying new things and being open to them. So I remember, my whole athletic career, it's like, you get in your cardio, you do your weightlifting, your resistance training. And I was really into that. That really felt good to like lift weights and be strong. And I remember moving to Chicago and trying yoga for the first time. And I had always thought yoga was like, not that hard, who needs it, whatever. And I remember being in that class thinking like, holy smokes, like there are muscles I have never felt before. And I tried something new and I actually grew to really love it. And it was a different way to move my body that I felt taught me different things. And it's good when you can kind of just get out of what you're normally used to and trying these new things out there. And luckily there's all these new exercise classes and everything, right? So like bar, yoga, Pilates, different ways to move your body, because we need to reconnect with that. Exercise doesn't always have to be intense. It can be just mindful movement. And we have to exercise for kind of different reasons. So health and well-being, I just want to do good for my body, not necessarily because there's a competition or I have to be the strongest or the fastest, but because I want to just do good for myself. And that's okay. And exercising for different reasons like creativity or energy, inspiration. I think that a lot of times too, athletes could go from, I've been a competitive athlete and I have, just been really intense. And now I'm going to take this break. And that's wonderful. They feel like they need to take this break from exercise. And then sometimes they just never come back to it, right? It's very hard to get motivated for exercise when you don't have people pushing you or you don't have sport to motivate you. And so there's that kind of side of things, or there's this side of things where you feel like you have to keep up with your intense regimen and it's either very hard to keep up with, or you don't find yourself keeping up with it, which leads to more negative feelings about yourself. Um, so, in order to kind of spark new interest, just getting out there, trying new things, getting maybe that workout buddy, but figuring out what do you really want to do with exercise? What do you want that to look like, and how do you want to maybe feel um, with exercise, after exercise, and kind of piquing new interest there. So with our next topic of nutrition and exploring the relationship with food, this one is a very important one as well that comes up so much in my practice is this fear of gaining weight. And a lot of times athletes do gain weight after they retire from sport or have to leave sport because so many things change. It's so hard to even grasp it in like one slide or presentation, but many things are at play here. So you have to consider your calories. So eating for your sport. Most athletes will eat for your sport, whether that's eating excessively to fuel yourself, like maybe you're a swimmer that has to eat 10,000 calories a day, and that's what you're used to. So then when you retire and you're used to eating that much, it's hard for you to eat less. Maybe you are a wrestler and you're used to those fluctuations with your eating and caloric intake. And so you're eating for your sport, and then now you don't have wrestling there anymore. And you're still kind of struggling with how to eat for yourself without the sport. So a lot of sports, you're either restricting or you're eating too much, or, some people will eat whatever they want because they don't have to care, or the other people will eat specifically for their sport and their body and be strict about it. So you have other people telling you what to eat, what not to eat. Maybe you have people checking in on you, coaches, trainers. There's a lot of critique there. There's a lot of pressure there. And this fear starts to creep up. So a lot of athletes will talk to me about their fear of gaining weight, but also fear of becoming out of shape, fear of, what will my body look like? What will people think? And it's all of these cognitions we have as athletes that are probably unconscious at the time, but we are always examining ourselves, right? We're always looking in the mirror and kind of making sure like everything looks right. And a lot of that has to do with our food and our food intake. So they can have strict or not strict regimens. It doesn't really matter, but the transition part is what is difficult. So this shift that we go through has to be kind of more, we have to dig a little bit deeper here. So, and I think everyone probably needs to do this, because food is an experience. Food is a cultural experience. Food is a coping mechanism. Food is used in so many ways in our society. And so there is a bigger issue with food as a whole and diet culture and all of that. But for athletes in particular, the nutrition and diet probably has to change after retirement. And if it doesn't and it works for you, that's amazing. But we have to explore this relationship with food a little bit more thoroughly. Like, why do I eat carbs? Or why do I eat junk food? Why do I eat sugar? And can you answer that? A lot of times it's like, oh, I eat sugar because I'm feeling sad, or I eat sugar because I just crave it all the time. Is there a bigger issue there with sugar cravings? What does food do for me is another great question. Does it make you feel good? Does it not make you feel good? How does your body function? A lot of times, a lot of foods can lead to inflammation, which causes pain. And do I feel that after I eat, this, that, or the other? I always suggest getting a nutritionist or a dietitian on your team for that transition, just to examine a lot of these questions with a professional and to explore that relationship a little bit deeper with them. It can be really helpful and useful, and it's somebody on your team. And investing in a healthy relationship with food is the key. So healthy relationship looks maybe different for a couple, everybody, but um, it's very important. I think most people probably don't have a healthy relationship with food, and we don't really think about it, but it is something to consider when you are going to go through this big transition phase in your life. So working on that mindset, what do I want my relationship with food to look like? Do I, a lot of clients, they talk about being bombarded by these thoughts of, I just ate this, that means I have to work out this much. Um, I can't eat this thing. I have to restrict myself from this. And inevitably that makes you really want it more. Or, um, struggling with just particular types of food. And there's so much information out there of, you know, gluten's bad for everybody, or fat is bad, or fat is good, and carbs are bad. And, there's different kinds of carbs. There's so much information out there and so many different diets that it gets very confusing, and people need to eat for their bodies individually, right? There's not one thing that's going to work for everybody. So eating for your body is really important. What are you maybe sensitive to? What are you allergic to? What works for your body and what doesn't work for your body? So finding out those things, figuring out those things will really deepen your relationship with food in a healthy way. And so some of the research about this talks about intuitive eating, and intuitive eating really, I really love this mentality. They really kind of want to push away from diet culture and say, you know what, you don't have to be restrictive, but you have to be mindful. So being mindful of your body and how your body reacts and what your body's wanting from food is really important. So a lot of times we just don't pay attention to these cues we get of being too full or getting full or being hungry, and we ignore them, we overeat, or maybe we undereat. And intuitive eating really helps you become more mindful of that process and how to nourish your body for you. And that is why it also works really well for non-athletic groups and athletic groups. So in some research about the intuitive eating, it showed that following retirement from sport, athletes described this process by which they were rebuilding their confidence and trust in food and eating. And I think that's so important, right? That's what this whole nutrition piece is about, is that there is a shift in this trust of food, and how am I going to eat for myself? What do I eat? And it's real, it's there. That is the struggle. The research also shows that, intuitive eating has been actually associated with reduced disordered eating practices. It increased these healthier choices in food, and it was good for weight maintenance among these non-athlete groups, which also it transitions into athlete groups. But they say non-athlete because retired. Also, sport environments and personnel. So those that promote dietary restriction and forbid certain foods are disrupting athletes' normal intuitive eating process. We have a normal intuitive eating process that tells us when we're hungry and when we're not. And when we're eating for our sport, it gets disrupted, and inevitably, right? So maybe you're eating extra because you're not hungry, but you have to because of the amount of calories you're exerting. And then when you're not playing anymore, you're still thinking in that way. So you have to kind of recalibrate your intuitive eating process. And so this research shows that it may take athletes years to relearn how to trust their bodies, which trust their bodies is a main point there. And trust their body's signal about hunger and when they're not hungry once they leave their sport. So it takes years when we don't pay attention to it and when we're not aware of it. So hopefully this awareness will transition now into whoever is listening to this or listens to this into their life to make that shift in mindset and be conscious of it. And now moving on to the body, which is huge, right? So The body is used as a tool in athletics. Our body is what we perform with. And if our body is working great and our transitions into our performance as being great, when we get injured, that's why we have a lot of issues that come with injury, is because then the body is broken. And this is one of the most important parts of I think the shift, and what I hear the most about, because I work with injuries so much and chronic pain. But the body is always on display in athletics, right? We face so many judgments, expectations, critiques, perceptions, and we have so many of those things for ourselves. There's just like, an expectation that you have to meet as an athlete of being your athletic body self. So athlete usually means fit. You're at the high end of the scale of performance. So what are the perceptions we have of our body, and what is the story we tell ourselves about our body? A lot of times when we are, performing and competing and it's going great, we're telling ourselves that everything is great, the body is great, the body is doing what it should. And so then when we transition out of sport and maybe we don't exercise as much, the body doesn't feel as great, or you gain a little bit of weight, or there's a pregnancy, or maybe there's some other life injury, or your body's just bringing down. I mean, there's so many processes that our body goes through, that our story might change. It goes from this great story to this not great story. And we want to be able to incorporate some gratitude and mindfulness and to make our story still have a good story about our body. So a lot of times we're over identifying with the body, and you literally think I am my body, but we're not. A lot of these things we don't have control over. And when you over identify, it causes many issues like a depression or anxiety about the body. And if my body cannot perform, then what? Worth is tied into the body a lot. If my body cannot perform, then my worth isn't there. I am not worthy. I don't feel worthy. And that becomes a bigger issue that I see a lot clinically, because we are in our body constantly, right? Like we're walking around, any ache or pain we notice. But in athletics, it's like, oh, I'm sore, like I did all this, it's a good thing. Or the scars and cuts and bruises, they all mean something. And then when we don't have sport to kind of connect that to, it becomes more of a difficult process that we have to ask ourselves, why is our body, what does our body need from us, instead of what is it taking? So when we talk about injury trauma, it definitely gets more complex. We don't consider the long-term effects of injury when we're competing. That's for sure. We'll do whatever it takes, right, for the competition, that's what makes athletics great. That's what makes athletes, like, you see it all the time on highlight reels, that people are, when they are throwing themselves around, it makes for the best kind of performance. And we don't consider in that moment, of course, what it's going to do long term. And the body disconnects. So when you're injured, this isn't me, this body is not me. So we're quick to over identify with our body, and then we're quick to disconnect from it when we're injured, because we inevitably lose control. It's perceived control. We think we have all this control over our body, and really in reality we don't. So that's the perceived control, is that really things happen to our bodies internally all the time that we just don't have control over. So I had to add this in here, this retired female athlete paradox, which comes from the female athlete paradox. So the female athlete paradox is basically talking about how female athletes have dueling identities. They have their sports self where they might look strong and muscular, but then society also says you need to look feminine, and this is what feminine really means. So there's been historically this issue with, well, I want to look athletic, but I also want to look like a feminine female, and it causes a lot of issues cognitively with female athletes, and it causes a lot of pressure, and there's a lot of expectation there. And when we become retired, and we have the retired female athlete paradox, which the research from that, this qualitative research shows that there were a couple different themes, and that women who are retired from sport try to start moving towards this more feminine ideal, but they also report feeling fat, flabby, and ashamed, and that there's this continued commitment to a former self, right? They're still trying to be committed to the athlete self, and when you do that, you don't leave room for this shift in mindset that we need after sport. And there's so many conflicting ideals overall, where I want to be feminine and I'm moving in that way, but I also want to be muscular, and I also don't feel that way because maybe my nutrition's off or my exercise is off. And there's all these swarming thoughts, and it gets very complex. And that's why it's so distressful and frustrating, because there's so many elements working against each other at one time. So this shift, the expectations and the body and the shift that has to occur, we have to be able to accept our body through the changes it will go through. We cannot expect that we're going to stay one way forever. And when we have that kind of expectation and that kind of, it's black and white thinking, it's distressful then. It's more distressful when we do go through a change. So inevitably there will be changes. And can we accept ourselves and our bodies through that change and know that it will come? Gratitude is a huge piece that I use with my clients a lot with their body. And when they feel broken in their body, is that your body has done really hard things. Like, we've thrown our bodies around and it has somehow, it's recovered, or it's still here, right? We're maybe still functioning, but it's maybe not at the function you expect to be at, but your body is still working and it's doing things every day for you that we don't pay attention to, right? Like, you're breathing right now and it's doing that on its own. That's amazing. So can we have a little bit of gratitude for the body and what it's actually given us and how it's overcome a lot of hard things? Can you take care of your body now? Not have this past mindset of what it was like to take care of your body then, but can you take care of it now that it's been through so much? What do you need to do to take care of you and your physical self right now as compared to before? The mindfulness. So just being mindful of your body, how it works, what are you feeling, what things have been good for you, what things don't feel good, and having this mindfulness and self-awareness about how your body functions is super important to give it what it needs. And separating self from your body image and performance, which is very difficult, right? So you are not your physical look, right? Like, so you gain some weight, let's say 15 pounds after sport, and it's like a very difficult thing to process. But at the same time, like, okay, I mean, you've gained weight. You're not any less than, you're not that weight gain. You are somebody, a person, a human with many qualities, and that is very different than just identifying with how you look. And that seems to be a huge struggle with my female clients. And performance, right? So separating yourself from your body and performance. Maybe your body doesn't perform as well. I know mine doesn't. And that has a big shift of, I should be able to do this. My body should be able to do this thing, and it's not, or it can't. And what does that mean about me? And what does it mean for me? And that's just over identifying. So can we separate ourselves from that? And letting go of expectations. So I feel like that's the most helpful thing. These judgments, letting go of these judgments, having a non-judgmental approach to how your body's going to change, letting go of expectations of how things should be, how I should be, how I should look, how my body should function, because there really isn't a should or an ideal there. That's all a perception that we kind of come up with ourselves. And so, can you kind of let go of these expectations to make room, sorry, for your body to just be and do what it's going to do. So lastly, we come to this identity shift, which is one of my favorite things to discuss. But there is a big, right, going from athlete self to retired athlete self. Inevitably, there is an identity shift that goes on there. And our identities as athletes are tied to how we look and how we perform, which is directly related to how we train, how we fuel, and how we function. So there's obvious reasons why going from athlete to non-athlete can be very difficult. Prior to retirement too is the ideal when establishing like your parameters of your identity. So start thinking about this identity piece before we exit sport. But if you've already exited sport and that wasn't the case, that's fine. I mean, there's always time. So self-exploration, what can you do now to kind of explore yourself as a retired athlete, explore yourself as somebody, whoever you want to be, right? Your athlete self is only part of you. It's not the whole being. So there's so many different parts of yourself that contribute to identity that maybe we just never thought about, and now is a good time to think about them. And you can seek out a therapist for that. That's great. I know that a lot of these identity issues have come back to the way we exercise, the way we eat, and how your body functions, and picking those things apart is really important. So who do you want to be, and then how do you get there? And like I said, I think therapy is a great place for that, or coaching. And I know Athlete Soul helps with all of these things, and their coaches are amazing with this identity shift piece. So, even if you don't feel like you're struggling right now in particular, but sport is coming to an end, or maybe you're like a year post sport or anytime, why not just ask the questions and see what you come up with? And I'm sure it will be fruitful in many ways. So paying attention to this identity part, and knowing that you have control in this. You have control over who you want to be and what you want to do. And there is a lot of power in that. And there's a lot of power in taking that back and taking control of it. So that's it for me. Questions?
Kelsey, that was great. Really interesting presentation. I have a lot of comments actually. Like I said before, if anybody has questions, you can share them in the Q&A or in the chat box, and I'll ask them to Kelsey. But I wanted to share a few thoughts, and maybe we can discuss as well to get this started. Listening to everything that you have said, I felt that there's a lot of habits and belief that needs to be sort of deconstructed from the sport experience. It seems that we come from like a really black and white, regimented, very controlled environment where emotions are often suppressed. It's often pretty cold in terms of relationship and in trying to be strong all the time. And so it feels to me that the biggest message here is to try to reconnect with the self and feel more on a regular basis. So like be more aware of what you feel in your head and in your body.
Yeah.
Would you think that that's the biggest shift that needs to happen?
Yes, I mean, I think that's kind of like the overarching umbrella theme is that the reconnection. Like inevitably you're moving yourself, you're transitioning into a different phase of life. So, when that happens in any realm, whether it's athletics or a parenting role or moving from college to grad school or to professional life, it's like any life, have to kind of recalibrate and think to ourselves, what are we looking for, where are we going, how are we getting there, what are we doing? Being mindful of yourself is such an important piece, because we're walking around every day influenced by so many things that we maybe don't even realize. But if you don't have a good perception of yourself or a good awareness of yourself, then it's going to cause a lot of difficulties in the future, where at some point you might be forced to look at it. So I actually think it's a really nice process to just dig deeper about yourself and learn more about yourself and how you function and why you function the way that you do. And I think that the emotional part, like, because we can't necessarily be emotional during our athletic careers and be free with that, is probably the one thing, like in my sessions, that comes up very often. And there's always a lot of tears, right? Because therapy is a space where people feel comfortable to express their emotions. But I think we're human. At the end of the day, you're human and you have emotions, you feel things for certain reasons. And it's good to know why that all occurs and to have this non-judgmental approach to yourself of, well, yeah, I was sad, so I cried, or I was angry and I yelled. And or what is happiness, and feeling joy. So I think what you said is, like, yes, the crux of everything. And it's just, that's why retirement is so difficult. There's so many moving parts. It's such an intricate, complex process.
I will go back to some of the questions that I have, but we have a question from one of our participants who is asking, can you speak to the unique experiences of female athletes, exercisers, as they are navigating pregnancy and postpartum? What resources do you recommend for these particular client patients?
Yes. I have had clients who are just, who are like marathon runners or love to like just exercise because they love to exercise, but they are very much into it, or athletes who have transitioned out of sport and have had children. And I think that world, like this world of postpartum, is very like up and coming. So we're talking more about the postpartum body and being more accepting of that and being more real. And I see it all the time on social media that women are more open to talking about and showing postpartum bodies and being like, this is real life, right? Like, we have a lot of expectations and high expectations of females just bouncing back after pregnancy. And some people do and some people don't. And there's a lot that goes into that. But I think resource-wise is, I have a lot of clients who have found solace in Facebook groups, postpartum Facebook groups, or pregnancy Facebook groups, or just having the freedom and the openness to be able to discuss, hey, this thing is hard for me, or this thing is burdening me. And therapy is obviously great for that, but who's your network? Who's your support? And having more support is obviously shown to be beneficial in so many ways. But I think that a lot of the female athletes I've had who have become pregnant talk about, in particular, trying to keep up their body physique while pregnant. And that's obviously very hard to do, right? And so again, it comes back to these expectations and having realistic expectations. And I don't think there's any one right way to go about it, right? So having that support network, I think, and being free and talking about what you're struggling with really goes a long way.
Thanks, Kelsey. And I have to add some resources. We are connected with Athletes Soul with a lady named Diana Redman, who is also she's a professional soccer player. She had her child during her career. She's also a sports psychologist, but she created an organization called Gibora. So I'm putting this in the chat. Her organization is fully specialized on pre and postpartum for female athletes. So she has a lot of resources on there specifically for pregnancy and pregnant athlete. And then another one is the Women's Sports Forum. It's funny that we're talking about it because our first meeting virtual event was yesterday, but there was a panel that discussed reproduction and women's health and different topics around this. So also another resource and another website to check out on the pregnancy with women athletes.
Yeah, and that gratitude and mindfulness piece comes in there a lot with, can we let go of the expectations and the judgments and the critiques and be grateful that like my body just went through this really difficult thing. Like childbirth is no joke, right? And your body helps you through that, and it recovers through that, and it's given you this life, right? So I think that the gratitude piece does go a long way, but inevitably women struggle a lot with their postpartum selves. So again, finding that support is great. So I love that you added these things in here. I'm going to check it out myself.
Great, super. Another question that I have for you specifically on the body and the exercise, and I do think there needs to be some sort of language shift as well, and not talking about I'm going training or I'm going to exercise, but rather, I'm using words that are a little bit more fun or related to social activity rather than necessarily as something that is imposed on you. But I was just curious of, in your experience, how long it takes for an athlete who's retired to learn to accept their new body, and obviously might be very different for one person to another, but I think a lot of athletes go through the fitness yo-yo after they retire because they're trying to figure out this piece between I want to look like an athlete, so I'm no longer an athlete, I want to exercise like one, but I'm not exercising like one anymore. Do you have a little bit of an idea on time frame? What have you seen in general?
Well, I think it's hard because so many elements come into play, and then I have individuals of all different age groups who struggle with this one particular thing. But I could speak to, my dissertation work with the identity piece, in which, your identity is transitioning. A lot of times athletes it's like a 5-year span for an identity transition. And that's when it works out. Like there's a lot of times where we can't make that transition because of life circumstances, or you just haven't found your niche or passion. But I think with the body acceptance, I think it's a lifelong process, right? Because you are growing and you are aging and you are going through different things in your life that your body is impacted by. And so you might get to a great place of acceptance and then sprain your ankle, right? And then it kind of starts all over again with the difficulties that come from spraining your ankle. So I think it's a lifelong process that we have to keep implementing different skills to be able to cope with what happens to our bodies over time.
Yeah. And I think it's really interesting also to see Athletes who transition into a coaching career right after their playing career, I feel like their transition is a little bit delayed when it comes to identity and even fitness, because they kind of continue on doing similar things. They stay within the network. They generally have to stay fit and they stay with athletes. Do you think that's kind of right? Do you see a delay in transition for those who stay involved with their sport?
Yeah, I think that, everything is, nothing lasts forever. Right. So there's a little bit of delay because you're so involved still in that sport atmosphere. And, for some people, it's just easier than others because some people find that acceptance a whole lot easier, that they've thought about it before. But I think there is a bit of a delay there. But also, what I see the most of is like that aging process. The issue then becomes with like, well, I'm doing this much work, but I'm not getting as much out of it. Like my body is slowing down, and that's what I'm seeing, and people then become not okay with age. And that seems to happen around like 40s and older. So, and it's different for men and women. I think that, I actually think that men have a little bit of a better time keeping themselves in shape longer, because women a lot of the times have children, go through pregnancy, and then there's hormone issues. So hormones play a huge role in all of that as well. But yeah, I do think that there's a bit of a delay there when people are still very much in the sport atmosphere.
Mm-hmm. And I do have one last question, and more related to your specialty, and talking about injuries. Do you feel that, I think for some athletes, and maybe for all athletes, rehab and taking care of your body is going to be an ongoing thing after you retire? And I think that's not something athletes ever thought about. Like you don't get in your sport thinking you're going to have to see a PT your whole life or have to do certain exercise your whole life, because you have used your body so much and abused your body so much. Is this something that you see in your practice as well, where maybe the mind has to catch up with what will be needed to continue to support the body for the rest of the life?
Yeah, I think this turns into, I'm going to say the word trauma. So it's a little bit of a trauma piece, because sport injury is traumatic. And, a lot of the clients I have who have chronic pain are previous athletes, and they originally come for chronic pain, and then it's like said, oh, I used to play sport, blah, 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 this is what happened. And, what I do with them, I actually do trauma work with them, because it's just it's a deeper process in the brain where the physical trauma is stored in the brain, and it's stored in there, and you have to be able to process it and kind of get that energy out in order to find realignment. And I think that, that's a process that I do with myself. Like I go to PT twice a week, to try to keep my body up and working. And it's a lot of frustration. And with the chronic pain, it's, a lot of passive suicidal thoughts come out of that, because if my body's not functioning the way that I need it to, and that I think is correct, then what is the point? Your body means so much to you, and the functioning of it means so much to you, that becomes your identity. And when it's not functioning, who am I and what is the point of being here? And that is the deeper trauma part. So I do think that we just don't consider that as athletes, right? Ever, that like we're going to be doing all these maintenance things for ourselves. Mm-hmm. But I know that, when for myself, what's helpful is to reflect back on that career and the highlights of it, and how, you know what, I have a lot of gratitude for that time and it's brought me here. But dealing with the chronic pain and stuff, it's very hard. So I do hope that anybody who's struggling with that will find a therapist to be able to process some of this stuff, because I've seen it once they do, and I use brain spotting, things start to kind of fall into place and they gain a lot of clarity, and some of that pain might even go away. So it's definitely a more intricate, complex process.
Kelsey, before we close off, can you talk a little bit about brain spotting? I know you and I have talked about it previously, but that would be interesting for our participant, I think, just to understand what it is.
Yes, brain spotting is basically a deeper processing. So when we do talk therapy, it's more of the cerebral cortex. And when we talk about trauma, that's more embedded deeply in the brain. And so brain spotting is basically, I wish I had my pointer. There is a pointer that we go across eye level of your visual field. And when I ask clients, I'll ask them, let me know when I should stop. And they will start to feel either something in their body, like maybe something starts to tingle or hurt, or they will have heightened emotions, and that's when they tell me to stop. So we stop on a brain spot, and then they just are able to freely process. So whatever they came in for, let's say sport injury, and they'll take me through their injury, and they are start to get activated about it. When we stop on the point, they are just freely processing whatever comes up for them. So whatever comes up is what's been deeply embedded. So it's energy, right? So we're all actually energy, and a lot of it is energy that needs to come out from this particular event. And they will process on a spot for sometimes 5 minutes, 20 minutes, an hour. There's different spots to stop on, and it's just a very interesting. I feel like people have to actually see it to understand it, but it's a neurocognitive modality, and there's research on it, and you can go to brainspotting.com and find out more. But it's been really useful, especially I work with the chronic pain and the injury. So it helps people overcome these mental blocks that they face. And it's funny because a lot of people look for clarity, and they're not sure why they feel the way that they feel. And when we're doing brain spotting, they come up with these answers, and I see it, and I'm like, oh my gosh, holy smokes! Like, you had no idea why you felt this way, and then you just really spoke about it. So people always have the answers. They hold the answers, but they need help maybe coming out.
Yeah, helping them getting those answers out. Maybe at some point we'll do a live session on doing like a live brain spotting. That would be interesting.
Yeah, maybe I can brain spot you.
Maybe we can try that.
Very interesting. And I had to do it myself with training. So, I had to do it myself. I know how it works and how it feels. And I think it's important to experience those things yourself before, utilizing them with clients.
Well, Kelsey, thank you so much for the presentation and the additional information afterwards. This was really interesting. If for one thing that I would retain from this is definitely that, nothing is set in stone, and everything is evolving all the time, including us and our mind. And it happens when we transition throughout life, whether it's when sport is over, or even when we go through pregnancy, when we change job, when we age. And so staying open-minded, practicing gratitude, being accepting of ourselves and how we're changing, I think is critical. So yeah, thank you again. And as I said at the beginning, this is being recorded and we will be sharing it on our website. So if you want to have a look at this webinar and the previous ones that we have on the website, it's at athletesoul.org. And I thank you again, Kelsey.
Thank you.